Good morning. October is Breast Cancer Awareness Month. We continue with our cardio-oncology series, When Cancer Meets the Heart, Protecting Both Matters. And today in part 3, we are going to focus on breast cancer and the heart and why women are especially vulnerable. We have been learning about the risk of cancer treatments and the heart, and today's session will be more on breast cancer. Women are the heartbeat of the families, and yet they often forget their own hearts. Breast cancer doesn't just affect the breast, but it can touch the very heart that loves, nurtures, and gives lives. Among all cancers, breast cancer is the one that has the strongest link to heart health, especially because of the very treatments that are used in breast cancer. So how do these therapies affect the heart? The therapies used in breast cancer treatment, and have mentioned some in part 2 when I was talking on how cancer therapy affects the heart. Common drugs used overlap with cardiotoxicity. We have drugs we call anthracyclines. Targeted therapies like Herceptin can weaken the heart muscle, and these are the main drugs used for breast cancer. Radiation therapy, which is part of treatment of breast cancer. Left-sided radiation can affect the heart and also the coronary arteries over time. Hormonal therapies that are also used during treatment of breast cancer, like tamoxifen, aromatase inhibitors, a number of those raise the cholesterol or increase the clotting risk. And we know cholesterol is one of the major risk factors for heart disease. There is also the shared risk window. Most women are diagnosed with breast cancer at the age of 40 to 60 years, which is the time you also have high cardiovascular risk. Why are women more vulnerable? Women are more vulnerable to the heart risk, and reason being they have smaller coronary arteries that are more easily affected. After menopause, there is also loss of the estrogen that removes the natural heart protection. Breast cancer peaks also at the time, as I've mentioned earlier, with rising heart disease risk. Some shared risks like hypertension, diabetes, stress also compound the danger to the heart. And we have mentioned radiation to the left breast increases the direct cardiac exposure. And here is the sobering fact. Heart disease has become one of the leading causes of death among breast cancer survivors, sometimes even more than cancer recurrence itself. That's why we cannot keep quiet. And that is why cardio-oncology is not a luxury, it's a necessity. It ensures that every woman who beats breast cancer can live long, strong, and heart healthy. So please stay tuned for the final part of this series tomorrow, where we are going to learn how do you protect your heart during, after cancer treatment, and even before cancer treatment. Dr. Muthui-Mutua, saving lives one heart at a time.